this is Soumitra and you are watching my YouTube channel Medico Soumitra. So today I am here with you a new and important topic, that is sexual disorder. Okay, just be with me, we will discuss. Okay, first we'll see introduction part. Sexual disorders are listed under behaviors, syndromes associated with physiological disturbances and physical factors. So definitely the sexual disorders always it is characterizing by the behavioral syndromes. So how they are behaving and how they are adapting certain behaviors, it is completely depending upon that. Okay, so behavioral syndromes associated with the physiological disturbances and physical factors. The disorders listed under adult personality and behavior. So it's a adult personality and a behavior, depending upon that only how they are adapting to a sexual things. Depending upon that only sexual disorders will be justified. Okay, then we'll see classification. So classification, under classification, four types of classification will be the gender identity disorders, psychological and behavioral disorders, disorders of sexual preference, and sexual dysfunctions. Okay, so gender identity disorders, psychological and behavioral disorders, sexual preference disorders of sexual preference, and sexual dysfunctions. Okay, now we'll see one by one. So first we'll see gender identity disorders. Here two will be there: transsexualism and intersexuality. So it's a disorders where the gender identity can be mismatched, like it will be a problematic gender identity disorders. So transsexualism and intersexuality both looks like same characteristics, same features, but there is a little difference. So in the transsexualism, we can see the person will be preoccupied with the wish to get rid of one's genitals and secondary sexual characteristics of the other sex. So whatever they are occupied, like from the birth, whatever they are occupied with the sex, like he could be male characteristics, or if she, then she is having secondary sexual characteristics like breast and vagina, etc, etc. So whatever they are having like preoccupied, they want to get it off, like they don't want anymore this one. So that is transsexualism. Then we are calling them as a transgender also, if they are wish to get rid of their own personal genital organs, then we are calling them it is a transgender also. So that is the transsexualism. Then intersexuality, almost same to the transsexualism, but little difference: the patients have gross anatomical or physiological features of the other sex. So here also the patients is having some birth genital organs, but from inside they are having different feelings, like they are a male can be feeling of female, a female can be feelings of male. So that kind of things we are calling it as a intersexuality. Understood? Then we'll see the next: psychological disorders and behavioral disorders. In that, only one is there, that is homosexuality. In this, sexual relationships are maintained between persons of the same sex. Example: lesbians like girls with girls, gays like boys with boys. This is very common nowadays, right? Lesbian and gays. So it can be treated with the behavior therapy, with abreaction therapy, supportive psychotherapy, psychoanalytic psychotherapy. That could be treated with the abreaction, supportive psychotherapy, psychoanalytic psychotherapy. Okay, then we'll see disorders of sexual preference. In that we'll see fetishism, transvestism, sexual sadism, sexual masochism, exhibitionism, and more, many more. So we'll discuss one by one. So first we'll see fetishism. Fetishism is the sense. So sexual arousal occurs with a non-living objects which is usually intimately associated with human body. Fetish objects may be bra, underpants, and shoes. So the sexually disorders or like affected individual can be aroused, sexually aroused by non-living objects like associated with the human body. Example like bra, by seeing underpants and shoes, all those things, they can be get aroused, sexually aroused. That is the fetishism. Then we'll see transvestism. Sexual arousal occurs by wearing clothes of the opposite sex. So they can get aroused by wearing clothes of the opposite sex. That is also a kind of disorder. Okay. Then sexual sadism and sexual masochism, both are almost same. So we'll see sexual sadism. Like you might have heard like sadist, sexually sadist. Like they want to be very wild whenever the sexual other sexual partner will be injured or like pain, then only they are getting aroused, sexually aroused. That is the sexually sadist we are calling it as a. Then sexual masochism. Here the person is sexually aroused by physical or psychological humiliation like torture or injury. Whenever the physical or psychological torture or injury happen to the other sexual partner, then only the person will be sexually aroused. Then we are calling it as a sexually masochism. Understood? Then exhibitionism. So exhibitionism is the in this the person is sexually aroused by the exposure of one's genitalia to an unsuspecting stranger. So you might have heard certain incident like in a playground or in an international match, some peoples are coming and running with naked bodies and they are showing their body parts. So that is the exhibitionism. Understand? So unnecessary exposure of one's genitalia and other sexual body parts. Okay, that is the exhibitionism. Then we'll see or we'll discuss like voyeurism, frotteurism, pedophilia, and zoophilia. So in voyeurism, this is the persistent or recurrent tendency to observe unsuspecting person naked and engaged in sexual activity. So here is a recurrent tendency to observe unsuspecting person like stranger persons naked and engaged in sexual activity. That is the voyeurism. This is also kind of disorders. Then frotteurism. This is a persistent or recurrent involvement in the act of touching and rubbing against an unsuspecting non-consenting person. So that kind of incident nowadays it's happening in the bus or local bus or local train. So while the women's only maximum times it's happening while they're standing, while they're sitting. So that kind of incidents are happening like rubbing the other persons will be sexual sadist, will be rubbing and touching their private parts and all. So that kind of incident where we can see this is also a disorders like frotteurism. Okay. Then pedophilia. It is characterized by persistent or recurrent involvement of an adult in sexual activity with pre-pubertal children. So here are the individual which very affected with sexually disorders. He wants to do or he wants to engage with sexual activity with the pre-pubertal children, like with children they wants to engage with sexual activity. That is the pedophilia. Okay. Then zoophilia, involving sexual activity with animals. So they want to involve in sexual activity with the animals like anything. Okay. Then we can see the sexual dysfunction, frigidity, impotence, and premature ejaculation. I think you all are aware of these terms. So frigidity in the sense absence of desire for sexual activity. So complete absence of desire for sexual activity. We can see that is sexual dysfunction and we are calling it as a frigidity. Then impotence in the sense so absence of penile erection. So because of that there will be unsatisfactory sexual activity and etc etc. So that is the main thing is like absence of or inability to penile erect. Okay, that is the importance. Then premature ejaculations before the completion of satisfactory sexual set sexual satisfactory for both partners. So premature ejaculation in the sense ejaculations happening before completion of the sexual satisfactory for both partners, that is the premature ejaculation. Then these all can be treated with psychoanalysis, hypnosis, group psychotherapy, behavioral therapy. So that all those sexual disorders can be treated with the psychoanalysis, hypnosis, group psychotherapy, and behavioral therapy. That is all about the classification. Now we'll see the general treatment, how we can treat all those sexual disorders generally. Like it could be, as I told in introduction, it is a kind of adaptation to certain behavior or personality. So it could be treated with the behavioral therapy, then supportive psychotherapy, then psychoanalytic psychotherapy, then drug therapy, hypnosis, and group psychotherapy. These all are the general treatment for sexual disorders. Okay, and thank you. So if you really like this video, please do subscribe my channel and don't forget to press the notification bell icon and share with your friends, those are in nursing or any other medical field, so it will be very helpful to them. And just stay with me, stay with my channel. Then thank you.